Hi, my name is Nick Crofts. I'm the Director of the Centre for Law Enforcement and Public Health. I'm current Chair of the Global Law Enforcement and Public Health Association. My thesis here in this talk is that we have systematically neglected a powerful ally in the response to the HIV epidemic, the police. Much of my talk is a reprise of what my colleague David Patterson from the International Development Law Organisation and I wrote in an editorial in a special issue of the Journal of the International AIDS Society on police and HIV in 2016. If you read the editorial, you don't need to keep listening to me, but I guarantee that nobody did. Nobody reads editorials. And not very much has changed since then. Without the police becoming part of the solution, they will continue to be what they are now in many places and most of the time, part of the problem, and often a major part. Police engagement in the HIV response is a critical enabler. So why aren't police a leading partner in HIV prevention? As you well know, many people are at risk of acquiring HIV because of socially and often legally prescribed behaviours which attract administrative or criminal enforcement practices and sanctions. Responses to such behaviours include detention in so-called treatment centres, incarceration, in some countries the death penalty. Sex work is illegal in more than 100 countries worldwide, and the possession, use and supply of illicit drugs is illegal almost everywhere. Male homosexual behaviour is illegal in 70 countries and attracts the death penalty in 10. Even where these behaviours are legal, the populations concerned are varyingly subject to much stigma and much discrimination. In all cases, the primary translators of the law on the books to the law on the streets are the police. Even where these behaviours are stigmatised but not illegal, the police, reflecting their communities, are often the major agents of discrimination. There's a clear connection from discrimination and illegality to heightened risk for HIV among these populations. The behaviours of police are therefore critical factors in shaping the risk environment for these populations. In many instances, for many people, the police are overwhelmingly the most important critical determinants of their HIV risk. There is much evidence of adverse police behaviours towards key affected populations and the adverse impact of these behaviours on HIV risk. For example, among sex workers, as again I'm sure you well know, police have been documented in many countries and circumstances using the possession of condoms as evidence justifying arrest for prostitution. The same is true for drug users with needles, syringes, and associated injecting paraphernalia, evidence of illegal behaviour. In countries where this behaviour on the part of police is common, much of the time the evidence, so-called, is used to extort money, sexual favours, drugs, or other bounty. In all instances, the categorisation of the police, by the police, of the person as a sex worker, a drug user, or a member of a sexual minority provides the apparent rationale for their treatment as less than human, with beating, torture, rape, and other human rights abuses common. These behaviours have been shown repeatedly to increase the risk of HIV infection and other adverse health consequences documented in countries as far and widespread as Russia, Azerbaijan, Kyrgyzstan, Cambodia, Laos, Thailand, Ukraine, Kenya, South Africa, India, many parts of the world. In response to police behaviours, people living with HIV and members of key affected populations take their lives underground, leading to circumstances of decreased safety, such as being forced to have or sell sex without the use of a condom or injecting with used equipment and in haste. The police behaviours also preclude or impede access by people living with HIV and key affected population members to prevention, treatment and care services. And they make outreach work difficult, especially when such outreach is undertaken by peers. Police practices often reflect community prejudices. People living with HIV and members of key affected populations are in many cultures marginalised, and through a variety of mechanisms, they become the demonised other. They are treated as outlaws because of their behaviours and not as full, rights-bearing community members. Police may act to protect what they perceive to be their community, the one from which they are derived, the one which they see as legitimate, and which to them abides by the dominant social and moral norms. This may be even more pronounced the more militarised the police force. And in this case, they concede their role as protecting society from the key affected population members, who are characterised by them as internal enemies. Police thereby become a key part of the mechanism of discrimination and the maintenance of stigma against these problems. That all this is the case is well demonstrated, well known. It is therefore puzzling that changing police behaviours has not been a more prominent goal in programs to address the HIV epidemic in many countries. There has been much less documentation of the impact of working with police to change these behaviours, partly reflecting the relative paucity of such programs. There are increasing numbers of reports of positive interventions, together with police seeking constructive, progressive and evidence-based approaches to the reduction of HIV risk. Positive policing partnerships between sex worker organisations and police in South Africa, for instance. But top-down approaches to law reform have been much more widely supported. I think with an implicit belief that police are universally guided by the law and used impartially. In other words, if we get the law right, police application of the law will be right. But changing the law can take years, whereas changes in policies guiding police practices and local solutions involving police, which are embedded in local knowledge and relationships, can be much more effective in a much shorter time frame. The report of the Global Commission on HIV and the Law in 2012 set out clearly the need for reform of policing practice, recommending that reform of policy and law must go hand in hand with reform of law enforcement practices and implementation of policy and of law by police. The Commission recognised that these are different activities requiring different focuses. Achieving reform in one area, in law or in police behaviour, does not guarantee concomitant reform in the other and is achieved by different means. The role of law enforcement, especially police, as partners in the public health mission is increasingly well recognised. There's an extensive body of literature going back decades, exploring the role of police in public health issues and documenting good models. Simple examples are the role of police in preventing road trauma. There's also now an international conference on law enforcement and public health and an international association highlighting the major public health partnerships in the fields of mental health, gender-based and family violence, road trauma, major events and catastrophes, alcohol-related harm, and many other public health issues. If this is the case for other public health issues, why not for HIV? Is it simply because people living with HIV and members of key populations are so stigmatised, more than almost any other groups in society? One reason for the failure of AIDS programming to engage police lies in the approach often taken to advocate with police, and I've been part of this. In effect, the message that we give to police and that police hear is, help us do our job of preventing HIV. The common response I've directly experienced is, that's your job, we've got ours, you go and do your job. That's often couched in much more picturesque terms. For effective advocacy and engagement, we need to look at the issues from the police perspective, which is something that the AIDS research community very rarely does. Leaving aside for the moment the issue of corruption, which cannot be ignored, police imperatives are all around crime control and public order and safety. Dialogues about public health or human rights imperatives often have little or no impact. For advocacy to work, we need to identify and align our approaches to the police interests, whether these be personal self-interest or in supporting their perceived mission. The key advocacy question is always what's in it for them. The task and the challenge is to get them to do our work for their reasons. For instance, some programs have used an approach highlighting occupational health and safety as a way to mobilise police support for needle and syringe programs. Occupational health approaches can deliver immediate benefits for both police and public health. Ceasing syringe confiscation, for instance, can reduce occupational exposure and limit sharing of injecting equipment by drug users. As an example of the latter of supporting their mission, the introduction of methadone maintenance in Vietnam was more supported and much more successful when police became aware of the crime control aspects of moving heroin-dependent users onto long-term substitution therapy. There have been many calls for an end to police harassment and brutalisation of members of key populations, nothing more poignant or urgent than at the moment. And for police to protect the health and rights of people living with HIV and members of key populations, just as they do other members of society. There are increasing calls, vibrant, cogent, loud calls for maximising the opportunity to recruit, to change police behaviour towards vulnerable populations. And there's increasing opportunity now to recruit police as partners, facilitators, and even leaders in HIV prevention strategy. Well, I think we're now at a very crucial time in terms of changing the relationship with police and the role of police globally. How can we best bring about this change? It's already happened or is happening in some police agencies worldwide. There's enormous discussion going on in some police agencies in some places. There are examples of good practice in relation to police engagement in the HIV response, especially the case in high-income countries with democratised police agencies, but it happens in other police agencies as well. I would argue that in general, those countries which have done well in the response to HIV and AIDS have generally involved their police intensively in the response and from early on. Increasingly, there is documentation of collaborative programs with police in addressing discrimination, stigma, and HIV risk that work also in low and middle income countries. The Law Enforcement and HIV Network lists a number of positive examples of partnership, identifies and supports police supportive of harm reduction, of drug policy reform, of legalisation and decriminalisation across many, many countries. Examples of partnerships between law enforcement agencies, governments, NGOs and communities to address HIV epidemics are increasing in number. Some of the major ones that have been implemented and evaluated include the Gates Foundation funded Avahan program in India, providing support for work with police in 6 Indian states, training for police, instructions to police not to use condoms as evidence, support of police for prevention. The Poro Sapot project in Papua New Guinea work to reduce harassment of men who have sex with men and with sex workers through training and sensitisation of police at multiple levels. The Hands Off program in Southern African states, which has moved into its 2nd phase, working with police to decrease violence against female sex workers, police being, and uniformed services generally being, one of the major customers of sex workers and one of the major causes of brutality and violence against sex workers. Enormously effective where these have been implemented. The United Nations Office on Drugs and Crime ran a series of joint workshops between police and members of key populations in a number of different low and middle income countries. And they contributed to the evidence that what works in changing cultures and behaviours is contact between police and members of the key affected populations outside the usual situations of conflict, which they normally find themselves at loggerheads in. Effectively rehumanising the one to the other. This aligns with what we know about working in stigma reduction. 4 necessary and effective approaches: information-based, sharing, skills building, counselling and support, and contact with affected groups. And then the last one, effectively rehumanising the police to the key population member and vice versa. Specifically, in the context of programs in some African countries I've been associated with, where police and sex workers are brought together in non-conflictual settings, one would hope it is more difficult, in fact, one would hope it is impossible for a police officer to brutalise or rape a sex worker who the previous day had been playing football with him and had served him a cup of tea. The conclusion is that a major shift towards a public health approach to policing is happening. It is possible among police agencies, but it's necessary also at the same time to strengthen civil society so that the partnership is respectful and equal. The challenge of engaging police in the response to HIV urgently, to me, needs far more consideration and much more sizable funding allocation than it's currently receiving. There are multiple neglected needs. There's been such an emphasis in research and programming on police as obstacles and barriers and enemies that the existence and the possibility of good practice has been obscured. As a result, the lessons learnt by individual programs have not been adequately shared within the AIDS sector. As I keep emphasising, there are good emerging good practices, but they need much greater documentation, evaluation, dissemination, and understanding of the principles that have made them successful, some of which I've outlined. What's in it for them? How do we rehumanize the one to the other? On this basis, such programs need to be adopted widely and scale up to have what we believe will be a profound impact on the risk to people living with HIV and members of key populations, and on the efficacy of AIDS programs. Funding urgently needs to be directed towards addressing these obstacles, and that's a real problem because the AIDS sector loathes to see scarce funding go to what is perceived as the enemy. Aside from spasmodic programmatic funding for this work, such as that provided by the Gates Foundation, by Open Society Foundations, by AIDS funds, by Global Fund from time to time, there's been little systematic recognition of the importance of this area. The Open Society Foundation supported a nascent global network of police supportive of the harm reduction approach to policing among key populations, the Law Enforcement and HIV Network. But lack of continuing funding means that this network is closing down. In 2012, UNAIDS identified sensitisation of law enforcement agents as key components of the national HIV response. The Global Fund followed in 2014, and more statements have been made about the important role of police in the response. So why have funders in the AIDS field held back from funding programs working with police? Without direct evidence, my suppositions include lack of awareness on the part of national AIDS program managers and on the part of donors of evidence of what can be done. More importantly, perhaps, a philosophical, political, and cultural reluctance by many stakeholders, including people living with HIV, members of key populations, to support an arm of the state seen so widely and often correctly as being oppressors of members of key populations. So our first urgent priority, as we wrote in 2016, as is true now in 2020, is the need for programs rigorously evaluated, evidence spread wide and far. There have been very few formal evaluations published in the scientific literature addressing the question of the impact on HIV risk and incidence of interventions of working with police. Do they work, and what works best? The range of other strategies for law reform and increasing access to justice can be systematically complemented by strategies for better police engagement. There's multiple strategies available, including integration of training on the police role in HIV prevention, and in working with affected communities and populations on human rights and on harm reduction, on violence prevention, such as the Hands Off program in South Africa, such as the positive policing partnerships. Continued professional development throughout the police personnel's career, and seeing this as an important role professionally of the police officers. Peer advocacy and education among police, just as important as among any other community. Police will listen to police. Policing is a closed culture. They're far more likely to listen to police than to health wankers like me. We need education and peer advocacy provided by members of police to their colleagues, such as that has been provided by the Law Enforcement and HIV Network. We need strategies and initiatives to keep bringing police together with communities they should serve, not oppress, in non-conflictual settings, to generate community-based strategies for multi-sectoral consultations. We need to address structural issues in policing, such as performance measures, especially the abolition of arrest quotas as a key performance indicator, including this sort of work as a criterion for promotion. And we need to address the bedeviled issue of pay for police. Where police are inadequately paid, they will seek their remuneration in other, often illegal ways. There need to be specific directives to guide police action in circumstances in which they have discretion. The recent police activity in relation to the COVID-19 epidemic is an excellent example of what happens when police do not receive adequate guidance or understanding of what their role is. And all of this for HIV and AIDS has to be integrated into broader police reform initiatives. The 2012 Open Society Foundations did a review of programs working with police globally, and they came up with 7 important elements for meaningful collaboration, some of which I've already alluded to. Appeal to police interests. Find what motivates them. Take a judo approach, use their strength to drive, but it has to be what makes sense to them in terms of their perceived mission. Secure support from police leadership, and nothing is as important in achieving support from police leadership as in peer pressure, peer education, peer contact with their colleagues globally. Develop regular and systematized police trainings that involve sex workers, involve people who use drugs. Again, bring situations of non-conflict to bear so that one can be humanized to the other. Engage police in commitment to feedback and accountability mechanisms. I have participated in such heartening exercises where police have gone to outreach centres, have sat and have listened to the experiences of the outreach workers in the affected communities, and have started to understand the implications of what their behaviours cause. Police engagement with sex workers and people who use drugs outside the frame of law enforcement, as I've said, informal interaction to build understanding and trust in non-conflictual settings. And on the civil society side, to work to organise groups of sex workers and people who use drugs. Such a successful strategy, such a key element of our HIV response, but bring it to bear in working with police as well. And lastly, and most importantly for me, sustained funding, which requires the recognition of the central role of this element of the response in the overall response. OSF concluded in that report, of all the elements noted above, sustained funding is critical. And yet efforts described when they were looking at the projects, the successful projects that they identified around the world, most of these projects had been cut back or ceased operation, such as the Law Enforcement HIV Network has, because of the withdrawal of international funding, even as all the other HIV and prevention and treatment efforts have continued and have had impaired success, have had much less success than they could have had the police been working with them. Our motto is always, if the police are working with you, you can do anything. If the police are against you, everything becomes difficult. Police can be your best friend or your worst enemy. Most often they're our worst enemy, and we work to keep them as our worst enemy. There is a broader police reform professionalisation movement going globally. What's happened in the United States with the George Floyd killing, with the murder, with the defund the police movement, all of this resonating around the world with Black Lives Matter is all setting the scene for the opportunity for meaningful police reform and reform of the relationship between police and communities. The need for police to better engage with people living with HIV and with members of key populations fits in well with these global movements. To address these immediate challenges, there is, as I said, an urgent need for better coordination between those multilateral, bilateral and local agencies working with different NGOs, with different community members, populations, civil service organisations, civil society organisations in different settings, on engaging with their local police agencies to find local solutions and local approaches. There are many training resources available, including curriculum and manuals for agencies working with police to use. But often, too often, as happens across the board in AIDS, rather than coordinating their development and use, many agencies continue to reinvent what is already available. Unless we engage police urgently, effectively in the HIV response, I don't believe we'll achieve the SDG 3's target of ending the AIDS epidemic by 2030. However, we need evidence for action. We need support of people living with HIV and members of key populations. We need national AIDS programs to address the issues directly and to begin dialogues with relevant other ministries. We need to integrate this move into the broad police reform agenda. And critically, we need funding to implement, evaluate and scale up evidence-based programs with police. Without police support, our other efforts to end AIDS 2030, I believe, will fall short. Thank you.